Good afternoon, everyone. House and Senate Democrats have repeatedly made clear that we will sit down with anyone, anytime, any place to negotiate a bipartisan agreement that reopens the government and that addresses the Republican health care crisis. We've also made clear that we will not support a partisan Republican spending bill that continues to gut the health care of the American people, because we're dealing with a Republican-created health care crisis that must be addressed with the fierce urgency of now. It's time for House Republicans to get back in town, get to the negotiating table, and get real about reopening the government and addressing the quality of life and cost of living challenges that the American people face all across the country. House Republicans canceled votes last week. House Republicans canceled votes this week. House Republicans appear ready to cancel votes next week. These people are not serious about reopening the government. Donald Trump and Republicans decided to shut down the government because they'd rather inflict that kind of pain that the American people are experiencing right now than address the health care of everyday Americans and the need to urgently extend the Affordable Care Act tax credits to avoid tens of millions of Americans from having to pay dramatically increased premiums, co-pays, and deductibles. This Republican healthcare crisis must be addressed with the fierce urgency of now. That's not a partisan position. It's a widely held view amongst the American people all across the country, which is why our position continues to be clear. We will sit down to negotiate with members of the Trump administration, with Republican leaders in the House and the Senate. We're ready to do it now, but we have to also address the Republican health care crisis. Questions?
Leader Jeffries. Thank you. Good afternoon. Yesterday, Leader Schumer indicated that the longer this goes on, this is better for the Democrats. Do you believe, as Republicans suggest, that that's a callous remark, that this is kind of a scorekeeping going on here?
House and Senate Democrats have been completely aligned, and we've taken a principled position in defense of the health care of the American people. Leader Schumer and Senate Democrats have courageously taken vote after vote against the partisan Republican spending agreement and bill, because that bill continues to gut the health care of the American people. This is an extraordinary health care crisis that even Marjorie Taylor Greene recognizes is a very real thing for everyday Americans all across the country. The largest cut to Medicaid in American history that Republicans have visited upon the American people. That's a real thing. The possibility of a $536 billion cut to Medicare that will take effect at the end of this year if Congress doesn't act because of the one big ugly bill. That's a real thing. The fact that unless we extend the Affordable Care Act tax credits, tens of millions of Americans are about to experience dramatically increased premiums, co-pays, and deductibles by thousands of dollars per year. That's a real thing. The fact that hospitals, nursing homes, and community-based health clinics are closing all across the country, including in rural America, that's a real thing. The Republican healthcare crisis is real. It's upon us. It's devastating the country. And House Democrats, partnering with Senate Democrats, are standing up on principle in defense of the American people.
Leader Jeffries,
have you spoken?
The president brought your name up earlier today during a cabinet meeting. Is that the first time that he has actually said your name out loud? And also, why is it important for you to have something resembling a working relationship with the president?
I guess it appears to be the first time that he has actually mentioned my name, but we obviously, more importantly, had a meeting a week ago to sit down at the White House, at the Oval Office, to try to negotiate a bipartisan spending agreement to, at the time, avoid a shutdown and also to address the Republican healthcare crisis. Unfortunately, subsequent to that Oval Office meeting, the Republican behavior has been erratic at best. Subsequent to that White House meeting, all we saw from President Trump were deep fake videos, threats to cancel projects, promises made to engage in mass firings, Republicans in the House continuing to be on vacation all across the country, and Leader Thune engaging in the classic definition of legislative insanity, which is doing the same thing over and over and over again, bringing the same partisan Republican spending bill to the Senate floor over and over and over again and expecting a different result. Things are not going to change until Republicans actually decide to get serious about a bipartisan negotiation, because our position has been well articulated in defense of the American people: cancel the cuts, lower the costs, save health care.
Leader Jeffries, have you spoken with Speaker Johnson about Congresswoman-elect Adelita Grijalva? Is he setting a precedent here that you could follow?
Well, Representative-elect Adelita Grijalva should be sworn in now. Should have happened this week. It should have happened last week. It needs to happen next week.
Leader Jeffries, you mentioned that you're willing to sit down with the Trump administration. You say that it's going to be up to President Trump to give Speaker Johnson and Leader Thune marching orders on how to resolve this issue. J.D. Vance is reportedly going to Indiana tomorrow to talk to Indiana Republicans about redrawing their maps. It appears that the president could be going to the Middle East in the aftermath of the peace agreement that was announced yesterday. Does that indicate to you that this shutdown will go on into the weekend, into next week? What are your thoughts about the administration's movements heading into the weekend as this shutdown goes on?
Donald Trump and Republicans shut the government down because they'd rather inflict pain on the American people than address the healthcare crisis that they've created. And the behavior that we continue to see, including the vice president apparently traveling to Indiana to try to rig the congressional map as part of their effort to steal the midterm elections, again reinforces the lack of seriousness in terms of their behavior, particularly as it relates to reopening the government or making sure that our military troops who are in harm's way are actually paid. And it's very unfortunate that their behavior continues to signal that they are uninterested in the type of bipartisan negotiations necessary to bring the Trump Republican shutdown to a close. I hope that changes. I hope it changes today. I hope it changes tomorrow. We'll meet with them anytime, any place, anywhere, either here at the Capitol or back in the Oval Office. But Republicans need to get serious about reopening the government. They need to get serious about reaching a spending agreement that actually makes life better for the American people, addresses the cost of living crisis that exists in America that Donald Trump promised to fix on day one, but costs haven't gone down on day one. Costs have gone up. The Trump tariffs are making life more expensive. And now, because of their refusal to deal with the Affordable Care Act tax credits, healthcare premiums are about to explode.
Leader Jeffries, would you support a standalone bill for military members? I believe that has happened in previous shutdowns. There may be a bill already introduced to do that now.
Yes, and what House Republicans need to do is come back so we can address the military pay issue and reopen the government. I mean, this is an extraordinary thing. It's unbelievable. Members of the House Republican Conference are upset and perplexed that their leadership has them on vacation week after week after week. The last day the House was in session was September 19th. Republicans got out of town before sundown, and we haven't seen them back in Washington since. This is extraordinary. This is a crisis, both in terms of the government shutdown, the impact on the American people, the impact on aviation safety, the impact on public safety, the impact on the health and well-being of the American people, and House Republicans remain on vacation. Their own voters are telling them, including the Republican Speaker, get back into town. Sit down with Democrats. Engage in a bipartisan negotiation. Reopen the government and address the healthcare crisis that they've created, which impacts rural America, small town America, urban America, working class America, black and brown communities throughout America, and the heartland of America. That's the focus that Democrats have. We need Republican partners to join us.
Leader
Thank
Jeffries.
you.
What do you think of the Trump administration's plan to pay for the WIC program with tariff revenue?
Yeah, I'm unfamiliar with that plan, but what we've seen in prior shutdowns is that presidential administrations have continued to provide support for women, infants, and children, and that needs to continue right now. And to the extent that anything different happens, it will be another example of the Trump administration using the shutdown to continue to inflict cruelty on the American people. It's the reason why the American people know who's responsible for shutting the government down and know that Republicans have been unserious to date about reopening it. Thanks, Nicole.
Thank you, Mr. Leader. We saw Congressman Lawler approach you yesterday after your press conference.
Who?
We also saw Democratic Senators Gallego and Kelly go to the Speaker's office yesterday. You say this is a crisis. What is stopping you from just going to the Speaker's office, going to Leader Thun's office to have this conversation that you want to have?
Well, it takes two to tango, and at the end of the day, we have continued to make clear that we will sit down with the Republican Speaker, with the Republican leader, with President Trump once again, with Vice President Vance, with people from the administration to resolve this crisis. But we actually need Republicans to decide to get serious. Understand, it's important for the American people to understand, they have the House, the Senate, and the presidency. This is Republican complete control of government. And from the very beginning of this presidency, they've taken a my way or the highway approach, a go it alone approach. It's not working out for the American people, and the American people know that things in this country are moving in the wrong direction, not the right direction, and that Republicans have complete control of government, that costs have gone up, not down, life is more expensive, that the healthcare crisis will be devastating to their ability to actually be able to see a doctor when and where they need it for themselves, their children, and their families. And as Democrats, we actually have come to the conclusion that we're trying to help them address the mess that they've created, because dealing with this issue related to healthcare costs, healthcare access, hospital closures, nursing home closures, community-based health centers closing in rural America, in red states, along with purple states and blue states, is just good for the country. And unfortunately, to date, what we've seen from Republicans is an unwillingness to actually sit down and find a common sense bipartisan path forward.
Leader Jeffries.
Have you or anyone in your caucus talked to Marjorie Taylor Greene this week about, given her statements? And also separately, how shocked were you that you are able to use her to prove your point?
I can't say that I've had a conversation with Marjorie Taylor Greene, but she is correct as it relates to the health care crisis that exists. And it's consistent with the point that we as Democrats have made from the very beginning, that Republicans have made a mess of the health care in this country. It's a broken system. It's a life or death issue. Yesterday, we heard testimony from a 29-year-old woman, Mariah Plant, courageous woman. She lives in Wyoming County in West Virginia. That's a state that Donald Trump won by 42 points. She's a small business owner. She also cares for her older brother, who's completely nonverbal and legally blind, requires around-the-clock care that Mariah lovingly provides. She's able to provide that care to her older brother because of Medicaid. which is now being threatened as a result of the Republican One Big Ugly Bill. The hospital in the rural part of West Virginia that she utilizes in cases of emergency is at risk of closing. And she gets her health care from the Affordable Care Act tax credits, which makes it affordable for her, given all of the things that she has to deal with. And if those tax credits expire, she's going to face thousands of dollars in additional expense and will be unable to see a doctor for herself, let alone be able to continue to care for her older brother in the loving environment in the home that she's in. We're fighting for people like Mariah Plant. We're fighting for her family. We're fighting for people in all parts of the country, which is why our position has been very clear. Cancel the cuts, lower the costs, save health care for every single American. Thank you all.
Mideast peace deal. Are
Thank
you
you all.
skeptical at all?
Thank you.